morning, everybody. Welcome to Financial Fun Friday. It is 10 a.m. on my clock, so let's go ahead and get started. As you can see, we have a special guest, but just give me a second. We're going to get to her. So here we go. Welcome, everybody. Yes, you are welcome here too. Did I cut that off too fast?
You good.
It's Friday, and it's Financial Fun Friday and Friday. So welcome, everybody. I am your co-host, Darlene Jenkins, and my other co-host,
Dr. Rita B. Rowland.
Yes, Dr. Rita B. Rowland. And we have a special guest there, Ms. Leslie Priest. I'm going to give you more information about her, but welcome, Leslie. But Rita and I, we are with Affordable Benefit Solutions, and this broadcast is being brought to you by ABS Financial Solutions, where we're always bringing you what's new and what's next in the financial industry. So for those of you that are joining us for the first time here, this is a webinar that we do on the first and third Friday each and every month. We broadcast at 10 a.m. Eastern Standard Time. And guess what? Hello, Facebook, because we're also broadcasting live simultaneously there. This is also when we do our check-in. So check in the comments, Facebook. Let us know where you're watching us from, because we know you tune in from all over the country. And same thing here for those of you live on the broadcast, where when you talk, guess what? We're going to talk right back to you. So drop in the comments and let us know where you're checking in from, and we're going to shout you out. But during this broadcast, what we do is we pull back the curtain so that you can get an in-depth understanding of not only your federal benefits, but we also are going to share different tips, financial nuggets, strategies, and we offer up some of the best practice retirement options for you to help you reach your financial destination. So Rita, do we have any check-ins?
They have been really quiet today, but I'm sorry, that's not true. That's not true. My apologies, Mr. Dees. We got Delaware has checked in Upper Marlboro, but that's it.
Okay, well, that's okay. You can check in. And guess what, YouTube? We're not forgetting about you, because we know you go back and you watch it. So in the comment section, go ahead and drop where you watched us from. So
wait a minute, Darlene.
Give you a shout out. Yes,
Let me give my shout out. Janice from DC is in the house too.
Hey, Janice, thank you for joining us. And anybody on Facebook, Rita?
Facebook is a little quiet. They're here, but they're a little quiet. So welcome everybody from wherever you are from. Welcome. We got Upper Marlboro, we got Delaware, we got, we watching from the home office of Affordable Benefit Solution, Mr. Robert, Charlie. So we got Largo, Maryland in the house. Okay, we're doing all right today.
Okay. And if you ever miss a broadcast and even go back and watch our broadcast, you can follow us on Facebook. So we are at Your AV Solutions, and just take a moment right now to share us out on your Facebook page. Don't keep your Financial Fun Friday team to yourself. Share us out. You can also go back and watch later broadcasts on YouTube. We are at ABS Retirement Solutions. Just put in at ABS Retirement Solutions, and you will get all of the prior broadcasts. And if you want to join us live here on the broadcast, you can go ahead and scan that QR code, or you can go to bit.ly at bit.ly/Financial Fun Friday so you can get on here. But let's get on into this information. But before I do, I want to let you know that the information we're going to be sharing is going to be general in context, but we have a subject matter expert on. So her information is not going to be general, okay? It's going to be very specific. But we share information on here, and it's generally, because we don't know everybody's particular situation, we can't tailor it to you. But what we can do, if you reach out to your Financial Fun Friday team at 301-577-6340, any information that we go over, we can tailor it to you. So reach out to us, 301-577-6340. So This is health insurance open season for the government employees. And it may be for you if you are in state government or city government. If your employer offers you an open season where you can choose between different health plans, you want to stay tuned. Health insurance open season for the FEHB is November 13th through December the 11th of this year. So perk up your ears as we share this information. Our President Joe Biden said health care should be a right, not a privilege for all Americans. So that's what we're here to provide you with, some information, know your options, some things to consider about your health insurance. Get your little checklist going so you know what to look for. And as we promised last week, we have a subject matter expert with us, Mrs. Leslie Priest with AETNA Health Insurance Company, one of the providers through the FEHB program. So Leslie, thank you so much for taking the time out of your busy schedule, because she is busy, you all. She is busy because it's open season. You all are calling her up, calling her team, and she's here for it. So
yes.
Leslie, please go ahead, take over and give our members the information that they're here to get.
Thank you so much, Darlene. I have got to tell you, it is such a pleasure to be here this morning on a Friday with Darlene and Rita. They make everything so much fun, because I got to tell you, she's right. I am exhausted. I have been traveling. I've been from Florida to Texas this year during open season. Most of you who are federal employees, you know that the agencies do open enrollment meetings or health benefit fairs during this time. As Darlene mentioned, open season began on Monday and it goes through the second Tuesday in December, which is December 11th. And so you have all of that time to review your plans, to change plans if necessary. We at AETNA say it is so important for you to review your plans. I think 5% of federal employees compare their plans during open season. That's not a good number.
No.
Because I know my fantastic financial advisors at Affordable Benefit Solutions will tell you that it is so important to review your plans, not only to possibly reduce your premiums, your out-of-pocket costs, but also get plans with benefits that will provide you lower copays, but are excellent benefits. So it's always good because plans are changing. Every year, your premiums may increase. You don't realize it because you didn't do the research, right, on those plans. And that's money that you could be setting aside for retirement, that extra money that you're spending on those premiums. So it's so important to compare. So I am going to share my screen now and get over to, let me see if I'm sharing. Let me know. Did it go through?
You are sharing, Leslie.
Great. And as I told them, I have about 15 minutes and it's high energy here. So I am going to start with right into some of our plans here. Let me go through this, not go over history. So AETNA not only offers plans through AETNA, which has been offered to federal employees for over 64 years now. AETNA has been in the insurance business for over 170 years, but we've been partnering with the Federal Employees Health Benefit Plan option for 64 years. In addition to our AETNA plans, and let me move this around so that it's not in the way. I don't have anything blocking the slides, do I? Okay, there we go. In addition to the AETNA plans that we offer, we also manage a couple of other plans, such as the Mail Handlers Benefit Plan, or MHBP as it is called. This plan is offered to everyone. It's a national PPO plan that anyone can enroll in. As a matter of fact, close to 80%, I think it's like 77, 78% of the people who are enrolled in the MHBP plan are non-postal federal employees. It's available to active employees as well as retired employees. And what's great about this plan is that It has very low out-of-pocket. We talk about how important reducing your out-of-pocket cost is on your health care, but yet having a great benefit. As you can see from this slide, the primary care visit is $20, which is rare. There are a lot of plans where, the primary care visits are higher than that. If you have dependents under the age of 21, the primary care visit is only $10. How often do you see a plan with a primary care visit of $10 and specialist is $30? The other great thing about this plan is most of your services, your visits, emergency room visits, hospitalization is a $200 copay. Most fall under just your copay. However, there is a deductible, and the deductible is applied to things like, for example, outpatient surgery. But it's a very reasonable deductible at $350 for self, $700 for self plus family. So this is an excellent plan option. If you want to see more about this plan, go over to that MHBP website at www.mhbp.com. They have several other plans that are available to you. Great premiums on this plan. If you look at this premium bi-weekly for self only, it starts at it's $80 for self only, $80.61. And then of course, depending on whether you're self plus one or self plus family increases. For those of you who are retired, that are looking for a plan as well, that's affordable, that goes a long way with fantastic benefits, and maybe you're not 65 yet and you don't have Medicare A and B, this is also a great option. Again, because of the premiums, the monthly premium on this for self only is only $174. So again, chiropractic is covered in this benefit only at your copay, no deductible on that. Your labs are covered at 100%, of course, as long as they use a network lab. So a great option for you. And then they have $350 that they give back to you in wellness incentives. So who doesn't want some money back for some of the things they do? A great option. Now, Aetna has what we call our open access plan. And some of you may be familiar with this plan. Some of you may even be enrolled in this plan, especially if you live in the capital area, DC, Maryland, Virginia. This is a great option as well, because what's nice about our open access, it's an HMO plan, but it's a national HMO plan, and it doesn't have gatekeeper on it. A lot of folks don't like HMOs because they feel like, oh, I've got to get a referral to go see a specialist, and all this extra work that I have to do, or red tape or whatever. Well, we've taken that away. With our open access plan, it's always been the case where you can self-refer to your specialist. It almost looks like a PPO plan, except everything is done in network, but it is a national network. So you can be in Los Angeles, DC, New York, Chicago, and still have access to networks. The copays on this plan, starts at $25 for your primary care physicians. It's a little higher when you look at your specialist, but the premium on this plan is great as well. It starts at $100 for self only, $195 for self plus one, and then it's $212, and this is bi-weekly for families. So what the other great thing about the open access plan is that it does include dental and vision. So when you look at this plan, the copays may be a little higher for things like specialists, but the dental does not only include your cleanings and your visits and your x-rays, the dental on your medical includes fillings. So if you still have children or dependents who are going to the dentist and getting fillings, we know how those kids are, reduce that sugar, then you don't have to worry about having a separate dental plan. This dental plan within the medical plan also covers those important dental things, everything except for like your crowns and root canals and things like that. So that's a great option for people who are looking for that. I'm going to skip over all these other plans. I'm going to have you go to our website. I don't know how I'm doing on time, but I know I have 15 minutes. So let me know, ladies, when it's time to cut it off or move on a little quickly.
Go
How many
ahead.
minutes do I have? Okay.
Go ahead. And then just Leslie, if you need a few extra minutes, if everybody that's online, that's here live with us on Zoom and those that are on Facebook, we're gonna ask you for maybe 5 minutes or so to give us a little extra so she can give you more information and so that we can answer 1 or 2 questions as well. So go ahead, Ms. Leslie.
All righty. So the other plan that I'm gonna mention that I want to talk about, and at some point, I know Darlene and Rita are thinking about expanding this type of webinar where you will have access to the health plans and information on how the different health products work. But I want to mention a high deductible plan with the health savings account, just to quickly show you a slide about that, just so you can see how that works. Most of you have probably heard of health savings accounts. Just to let you know, those look like traditional PPO plans. The difference is you'll have a high than you would on a traditional PPO plan without the health savings account. However, you do get extra benefits when you have a plan like this, where we will provide you what we call a premium pass-through. So we're taking part of your premium and we're giving it back to you, and we're putting it in a health savings account. In this case, with our HDHP plan, we're going to give you $66.67 per month, up to $800 a year for self, and then $1,600 a year for self and one or self and family. And you can use those funds to help pay your deductibles, your co-insurances, or any co-pays that you may have. You can also add to it HDHP plan with the health savings account tax-free. So that's what a lot of folks like about it. It's another way, and of course, my experts can tell you also more about this. It's another way to reduce your taxes and to save money for future health care costs, because those HSA funds roll over forever. So take a look at those. If you are healthy, you don't necessarily have to be young. People say young and healthy because you can be old and healthy, right? And you're not going to the doctor a whole lot, and you want to be able to save money, and you want to save on your taxes. The HDHP high deductible plan with the health savings account is a great option for you. So I am going to move on because I know that we are, limited on our time, but I just wanted to talk a little bit about retirement and folks who are over 65 and health benefit plan options that are available to you as federal retirees. One plan that is becoming very, very popular all over for everyone, not just for federal retirees, but for everyone who is Medicare eligible, are Medicare Advantage plan options. You see the commercials. You probably have friends or relatives who are enrolled in this type of plan. Aetna offers this plan, and so does there are a few other carriers who offer this plan as well. Just making it a little generic and being honest with you. But it's a great option. If you have Medicare Part B, you're paying those Medicare Part B premiums. Medicare is primary. Anyway, regardless of what plan you have, Medicare is primary, but not all plans provide you with benefits that coordinate well with Medicare, considering that you're paying this extra premium. The group Medicare Advantage plan is offered through Aetna for federal employees or federal retirees, waives your deductibles, waives your co-insurances, waives, all of your medical co-pays except for on prescriptions. And on those prescription co-pays, it's minimal, $2 for preferred generic, $10 for generic. But the wonderful thing about this type of plan is that we're giving you money back to help pay your Part B premiums. We're doing it as a credit that goes directly to Medicare. So we're paying into CMS or Medicare on your behalf, $100 per month, $1,200 a year that you can put back into your pocket. So for 2023, the Medicare premiums are $164 and I think 70 cents or 90 cents. We're paying 100 of that for you each month. So basically you're paying $64 for your Part B premiums. Next year, I believe it's going up to $174. It's either, I think it's $174.70 for 2024. But we're again trying to help reduce cost, give you great benefits because you're getting 100% coverage on your medical. It includes unlimited chiropractic care and acupuncture care with this plan. The other great thing about this is the premiums, $125 a month for self only, $275 for self plus one. And this plan has had the same premiums for 5 years. So that's a great option for retirees. The other great thing about this type of benefit is the extra benefits you get with it, or this type of plan. One is transportation. I know as we age, it's hard to get to and from our doctor's visits. You get transportation. We're going to make sure you get there. Round trips every month. Or if you can get there and can't get back, you can do a one-way trip. Meal benefits. When you're admitted to the hospital, when you discharge, who feels like making a nutritional meal, right? But it's so important in our healing journey. We provide you with 2 meals per day for 7 days. And then those of you who are still active, still going to the gyms, I know how important this is. I'm talking to retirees every day. Free gym memberships to any gym that participates with Silver Sneakers. So lots of great benefits. I'm going to end it there because I know we're kind of out of time. If you do decide, if you're a retiree and you want to enroll in one of these plans, you go to OPM first. If you go to our Medicare Advantage option, then you have a 2-step process where you contact OPM to enroll in a plan, and then you reach out to Aetna at our Retirement Service Center. So go to Aetna.com if you want additional information. Oh, do you all want me to real quickly go over dental and vision? Dental and vision are offered as well. We offer a couple of dental plans. You're going to see the plans that do offer dental usually have a high option, a standard option. Basically, the difference is how much you're going to pay out of pocket, right? What percentage, depending on what class of service you're using. Which is preventive, is always usually covered at 100%, unless you go out of network. I got to tell you, with Aetna, you can go to any dentist. We're still going to pay. There are some plans where you're locked into their network. Ours is not. It's a PPO dental plan, so you can go in or out of network. And depending on what which plans you choose, high or low, you may have deductible co-insurances. Now, those of you who are happy with your plan, still do your research, but don't want to change, but you're interested in dental enrollment is done and vision is done through Benefits. So you got to go to benefits.com to review the different dental plans. And if you're going to do any changes or enroll in a plan, you have to do that through benefits.com. Of course, as federal employees and retirees, dental and vision is available to you during open enrollment every year. And you do have several options with the dental and vision plans as well. This is our vision plan, standard high option, no copay on your eye exams. Depending on which plan you have, we're going to give you a certain amount towards your frames. $300 on the high option. You don't have to go to a certain section to get your frames. You can get designer frames if you like, frames for every family member with that amount. And you can get frames every year. And as you can see, when you take a look, all of those other things are on there as well. So just want to say, if you have any questions about health insurance, and we do what Darlene and Rita do too. We consult with you, right? You can go on to our website and schedule some time with any of us, me, my coworkers, and we'll call you at that allotted time. We open our schedule up for what we call AFL calls. So if you want some information, please feel free to come back and go to our website and schedule some time with me and any of the other team. Thank you so much. I think I went well over my time. My apologies to you. And I'm going to turn it back over to Darlene and Rita. And hopefully we'll do this again and I can go over some other stuff and we'll have a little bit more time. So thank you so much, Darlene and Rita and Affordable Benefit Solutions, for allowing me this opportunity to present for you. Thanks.
Thank you,
Oh,
Leslie. And I just have a couple questions. So, darling, I had a few questions. So let me know when you are ready. Leslie, we have some questions for you. So
Okay.
come off mute. Darling, you ready for my questions now?
I am ready for your questions, Rita.
Okay, so one of the questions was, in the open access plan, will you do a Medicare reimbursement in that plan?
We do not. So we only have Medicare reimbursement in 2 of our plans. I didn't talk about the Aetna Direct plan, which also coordinates well with Medicare. We waive the deductibles, we waive the co-insurances, low co-pays. That when we do a $900 reimbursement on that plan. It's $1,200 on a Aetna Advantage plan, and it's $900 on the Aetna Direct plan, which is offered to federal employees as well.
Okay, so then the second question is, which of the plans, because the issue that I have, remember my husband is Medicare age and I am not. So one of those plans we can't get, or can we not get either one because I'm underage?
So if you want a plan like the Aetna, if you have a spouse who is under the age of 65 and you're 65 and you're eligible for Medicare, the plan I would recommend is the Aetna Direct plan or the MHBP plan, because those 2 plans have plans where Medicare coordinates with the Aetna Direct plan. So we're going to waive the deductible, waive the co-insurances, and you get the fund. The non-Medicare eligible has access to the active benefits. So you're going to be subject to the co-insurance deductible, so just look at that plan in terms of the premium, what the out-of-pocket would be in terms of your deductible and your co-insurances to see if that's a good fit for you. But if you're in a situation like that, either the Aetna Direct plan or the MHBP plan are options, good options. What I like about the MHBP plan, if you're in that situation, is the premiums on that MHBP plan are very affordable. And also you can opt into a Medicare Advantage plan on the MHBP option, because they actually have the standard option where you can opt into the Medicare Advantage plan. So those 2 are the 2 that I would recommend in that situation.
Okay. Yeah, we're going to have to have an appointment.
You and I can talk. Okay.
Yes. So I have another question. It said,
go ahead.
So the other question is, has any entity done research and compiled information on specific benefits for specific conditions such as hearing loss? Hearing aids can run over $5,000 because my dad has a hearing aid and it's very expensive. And so she's interested in hearing aid benefits. Do you guys offer that, or is there any?
We do. Yes. So it's a $2,500 credit for your hearing aids. So we're going to give you $2,500 on both plans for your hearing aids every 36 months. The great thing about having a plan and getting access to hearing aids is that we also contract with providers who offer the hearing aids at a discount. And I have spoken to retirees who have gotten hearing aids and didn't have to pay anything out of pocket. The entire $2,500 covered their hearing aids. They say they're great hearing aids because of the provider that we use. With the discount and with the credit, they've been able to get their hearing aids for the $2,500. Or if there's out of pocket, there's limited out of pocket. But we do offer a hearing aid benefit on both plans.
Good. Okay. Well, thank you for answering that question. The next question is, what's the provider code for the Aetna Medicare plan, the PPO for retirees?
Okay.
And then the second question she asked is the MHBP plan used in Delaware, because we know these plans are state specific.
Yeah. So these plans are not state specific. So because these are federal employee group plans, right? These plans are national plan. The MHBP plan is a national plan. And the Aetna, this is for the Aetna Direct, Aetna Advantage. Now, the open access plan is a regional plan that's specific to the capital area that I mentioned. But the other plans are all national plans. So are you asking for the enrollment code?
She's wanting to know the provider code. No, I think she's meaning the enrollment code.
The enrollment code, right.
A retiree, because she is retired.
Yeah, so she needs the enrollment code. So for the Medicare Advantage plan, the enrollment code is Z24 for self, so Z24. And for self plus one, it's Z26. And I usually do South Plus One or South. I give you those codes because most retirees don't need family code. But if you do, family is Z25. So it's Z24, Z26 for South Plus One, and Z25 for family. That's for the Aetna Advantage if you want to opt into the Aetna Medicare Advantage option.
Righty, those were all. Well, we got some. Is there any more questions? I think I've answered all of the questions.
Oh, great.
Darlene, unless you got some, I think that was it for me.
No, that was it. Leslie, thank you so much. That was some great information. Wasn't it, everyone? I mean, Leslie knocked it out the box. And that's what your Financial Fun Friday team is here to do, support you in the areas when things come up. We bring on subject matter experts. So, hey, thank you so much, Leslie. We want to make sure we are bringing the fire to you. So, with that said, let's just move on. And we appreciate everybody hanging in here with us. And as Mr. Alan Lakin always says, well, he said it once and it's out here forever, rather, that planning is bringing the future into the present right here so you can do something about it now. That's why Leslie was on here, going over the ins and outs of the Aetna plan. And we would just challenge you also, as Leslie said, only 5% of employees actually do any sort of comparison. So we would challenge you to help increase that number by doing your due diligence and looking at some other plans. And guess what? Contact your Financial Fun Friday team so that together we can help you map out a strategy to help put all of the pieces together. We're going to send out, Leslie, that contact information. We're going to post it on Facebook. We'll send an email blast to all of the people that are on here today with her contact information. And guess what? Share her information out and share this video out. So thank you so much for joining us. We are normally broadcasting the first and third
Friday. First and third Friday.
Thank you, partner. Friday. This is your Financial Fun Friday team, and we appreciate you joining us today. And come on back, reach out to us if you have any questions, 301-577-6340. So we appreciate you all so much.
And darling, can you just add that